for the Evidence Capacities webinar series. The topic that we are discussing today is Innovative Capacity Development for EIDM in Africa. And then we are looking at addressing structural and value issues within the ecosystem. Thank you very much for joining us. My name is Siziwe Ngabe. I am the co-chair of the Africa Evidence Network. I'll be chairing this session this afternoon. You are all welcome in this session. Just to make things easier for all of us, just to let you know that we are recording this session because we want to be able to share the recording with you at the end of the session, and also with people that have not been able to attend this session. And you're welcome to participate as much as possible. You'll be given that opportunity towards the end of the session, but please continue using the chat if you have questions, you have inputs, to make sure that we capture your thoughts and your input during this session. We have made our cameras off just to save bandwidth for us, and also ensure that people that have slow connection are able to participate as well. And we've also kept your microphones off, unless we're prompting you to say something. The facilitators will unmute your mic to make sure that there's no disruptive background noise during the webinar as we are recording. If you are experiencing any technical issues, Charity is online to be able to help you in that process. And also she's managing the chat box. So all your inputs and questions will be fed to the moderator to make sure that we touch on them and be able to have more conversation. Just to also just give you a bit of background about the manifesto. The manifesto for the capacity development was developed by a working group in 2020 as an output for Evidence 2020 online. And this manifesto is just a declaration by All Africa ecosystem about the kind of capacity we want to practice. And also it is an Africa-led approach because of enhancing capacities, because all partners and individuals from the continent contributed to the manifesto and are continuing to contribute to this manifesto. And also it serves as a resource and an inspiration to the evidence ecosystem in the continent. And most importantly, it challenges the mainstream views on capacity building for EIDM in Africa. And please take time, if you've never seen it, take time. It is available on the AEN website. And I think we'll also put the link on the chat so that you can look at it as well. If you have inputs, please share your inputs to enhance and strengthen the manifesto. To share a bit about this series, the Evidence 2023 Capacity Webinar Series system to strengthen these efforts and improve the illustration of the manifesto, which is why it is so important to go to it and see how you can also enhance and contribute to it if you work in Africa and in the space of capacity development. Having said that, I would today, the objective of this session, I think, is more to harvest innovative approaches that are being deployed to address structural and value issues within the ecosystem. I think I'll now hand over to Kirchuffs, who is the moderator for today, who's going to be moderating the session this afternoon. Over to you, Kirchuffs.
Thank you very much, Siziwe, and thank you everyone for joining us from wherever you are around the continent and beyond. Today's session, I am sure, is going to be an interesting one, looking mainly at the structural and value issues related to evidence-informed decision-making capacity development. And at this point, we have well-resourced persons who have been working on the practice from around the continent who will be joining us in these discussions. We have Albert van der Linden. We have Elizabeth Ombech, Faraja, Kotta, Nyalandu, and then we have Michala, Assankpon. So these four people will be taking turns to share perspectives on these issues that we will be exploring. So just some background details on them. Albert is a data analyst and a research lead for Cenfri, Rwanda Economy Digitization Program. He's responsible for leading the analysis on government and private sector data to inform key policy and business decisions in Rwanda. As part of the program, he works closely with government entities and private sector businesses to understand their analytical needs and how their data capacities should be built to deliver on those needs. Albert has worked at Cenfri since 2015. Founded in 2008, Cenfri is a not-for-profit development consultancy with offices in Cape Town and Kigali. The Rwandan Economy Digitalization Program, which is implemented by Cenfri in partnership with the Rwandan Ministry of ICT and Innovation and the MasterCard Foundation, demonstrates the use of data for public policy and private sector strategy. Catalyzing data-driven policymaking practices requires an artful blend of aligned incentives, building relationships and trust with people in a range of public sector institutions, building data skills within the institutions, and knowing which questions to ask of the data and what the answers mean in a given political and economic context. So from this background, we can be assured of some insightful perspectives on the issues to be discussed. Elizabeth Ombech is the Monitoring, Evaluation and Operations Lead at Afya Research Africa, a center of excellence in Kenya affiliated with the Joanna Briggs Institute at the University of Adelaide. Afya Research Africa actively partners with research institutions, health agencies, and development organizations to advance the utilization of research and of evidence in healthcare. In collaboration with the University of Adelaide's Joanna Briggs Institute, Elizabeth spearheads the training of healthcare workers in evidence synthesis, leading a dedicated team of health professionals. She oversees the systematic review synthesis on diverse health topics. Additionally, she facilitates training programs on evidence synthesis and its integration into healthcare practice, working closely with JBI. She holds a Master of Science degree in Public Health and a Bachelor of Science degree in Medical Microbiology from Jomo Kenyatta University of Agriculture and Technology. Elizabeth has received certifications in Comprehensive Systematic Review Training and Evidence-Based Clinical Fellowship from JBI. Next, we have Faraja Kotta Nyalandu, and she's a resourceful social entrepreneur, passionate about developing cutting-edge social and educational programs that support children and women's development. With over 20 years experience in developing partnerships in private and public sectors, mobilizing communities and leading strategic advocacy. In 2013, she established Shule Direct, a thriving organization that provides comprehensive digital educational platforms offering national curriculum-based learning content across multiple subjects to millions in and out of school youth. The enterprise also hosts Ndoto Hub, that's Tanzania's first startup innovation hub exclusively for women entrepreneurs. Faraja is the current elected chairperson of the Tanzanian Education Network, the official national education CSOs network. She's also the elected representative of Africa in the Global Campaign for Education Board. Faraja leads teachers development and support for the East Africa's Regional Educational Learning Initiative, that's RELI, and that's in the Tanzanian chapter. Recognized globally, World Economic Forum appointed her as a young global leader class of 2020, with a tenure of 5 years, where she is also serving on the advisory board. She's also a member of the forum's expert network after serving on the Global Future Council for Education, Gender, and Work. She has been awarded the Leading Woman in Technology in Africa award for her work with Shule Direct, Tanzania Leadership Awards, Hall of Fame, Woman of the Year, and a system innovator for systemic change in digital learning in secondary school education in Tanzania. Africa Youth Awards has named Faraja among 100 most influential young Africans. In 2022, the president of Tanzania appointed Faraja to serve on the End Malaria Council for 3 years. Faraja is a qualified lawyer with the Bachelor of Laws degree and the Master of Laws degree in Human Rights and Migration. Finally, on our list, we have Michala, who currently works as an evaluation officer at the WFP, that's the World Food Program's Regional Bureau for Latin America and the Caribbean, where she co-facilitates the National Evaluation Capacity Index Initiative, that's INSI. The program seeks to contribute to strengthening national evaluation systems by providing regular information on the existing capacities and its changes. It's also a platform for South-South and triangular cooperation. Currently, WFP and its partners are exploring the possibility to launch a similar initiative in sub-Saharan Africa. Michala is an active member and contributor to the National Evaluation Capacities Development Working Group within the United Nations Evaluation Group. Among her other responsibilities is to provide technical support and quality assurance to evaluations commissioned by WFP in the region, and her particular focus has been on joint evaluations with governmental actors. Previously, Michala worked with UNICEF and several non-governmental organizations in monitoring, evaluation, and program management, mainly within sub-Saharan Africa. She holds master's degrees in international relations and international public health, where she developed a passion for systems thinking. So, audience, these are your panelists, and panelists, I'm sure we're very much ready for our discussion today. I would want to give an opportunity for everyone to share their perspectives first on the subject matter, which is that you will share with our audience what your individual programs are doing to address structural and value issues that work against EIDM practice within your respective ecosystems. I would start with you, Albert, and then the others would follow. So Albert, and then I would go to you, Elizabeth, and then I'll come to you, Michala, and I'll finish this round with Faraja. Yes, Albert, if you're there, you may want to open up and share your initial thoughts.
Thank you, Kirchuff. It's a pleasure to be here with all of you. And thank you for the opportunity to speak about this very important topic. So just maybe just a bit of background on the work that we're doing in Rwanda is that we are assisting or enabling the government of Rwanda and then private sector players as well to use their data to make decisions. So it very much aligns with the evidence-informed decision-making that this webinar is about. And within that program, we have a strong capacity building component to our work. So I lead the technical data analytics work that we do with our program partners, but then we also work with staff members at our partners to build their capacity, and we do this in various ways. So we have a traditional I say traditional, but training courses that we offer on various levels of data science. And I think that has been fairly successful. But there are two standout learnings for me so far from our work, and that I think is perhaps quite unique. The one is that working alongside staff members at our partner institutions is really the most effective way to build their capacity, because in order to develop a culture of using evidence to make decisions, you need to spend quality time with people. And working alongside technical team members really demonstrates the value to them of using evidence to inform decisions, and also builds their skill set in a more sustainable way, rather than just for them to attend training courses. I think the other point that I would like to emphasize at the start is, and this may be a bit specific to the context of the work that we're doing in Rwanda, but you need to create the demand for evidence within institutions and within systems. So we work closely with policymakers, and if there's a culture of using intuition and past experience to make decisions, then that is a culture that needs to change. Because what we found is that you can spend a lot of time and effort building the capacity at the technical level for people to generate evidence. But if the decision makers, so at the strategic level, if the decision makers do not request data or evidence to inform their discussions, to inform their decisions, then the whole system of evidence-based decision-making sort of collapses, because your junior team members then also don't have an incentive to generate the evidence to inform decision-making. So really those two learnings is something that has been very apparent for me in the past 3 years of our program. Thank you, Kirchuff.
Thank you very much for those initial thoughts, Albert. Let me come to you, Elizabeth. You may want to unmute and then share your initial thoughts with us.
Yeah, thank you, Kirchuffs, for the introduction and the opportunity to participate in this webinar. So a bit on the background on what Afya Research Africa does. We work in 3 thematic and related areas of health. That is a provision of primary healthcare, health technology, and we have the research and evidence bit. So as an organization, we work in the healthcare space, and we realize there's lack of capacity and lack of knowledge on how to use evidence in the daily or in the usual medical practice. So as part of that, we partnered with John Briggs Institute at the University of Adelaide in Australia to have capacity within the country that can be used to build the capacity of healthcare workers within Kenya and also in the region. So what we do is we promote evidence-based health practice and also evidence-based implementation of projects and programs. So at organization level, in the projects and the programs that we implement, we seek out to find the evidence of the best available evidence, or if there's evidence at all on our areas of interest. So having this partnership and collaboration with JBR has helped us to build a network or a community of healthcare workers who appreciate and use evidence in their healthcare practice. And this partnership has helped us address some of the structural issues that are there in use of evidence or appreciating evidence. And those are things like limited funding for people to build or people to have access to such critical skills. And these skills enable the health workers to critically appraise and interrogate evidence into their practice and also integrate it into their general practice. So having the collaboration means we can build capacity at subsidized and waived cost. And we have this capacity within the country, and they keep on, we have that community that is there, that is building and spreading out the importance of using evidence in healthcare practice. We're aware there are new, the way things are changing, technology is changing, and there is need for more evidence in practice in terms of also healthcare practice, diagnostics, and treatment guidelines. They keep on being updated, and this is informed by evidence. So our key at the organization level is to build capacity and build a community of healthcare workers that appreciate the use of evidence. And also we work closely with the government at the local level where we implement our programs. And also we've tried work actively to have the government appreciates evidence in their practice, because we see that is one of the things when it comes to value. There is not much value, or there is a lot of what we say, there's a lot of issues in limited evidence or limited uptake of evidence, especially by the policy makers and other practitioners, and it could be due to limited appreciation of research or lack of trust in evidence, or even just to say lack of evidence literacy. So that is, those will be my initial thoughts on some of the structural and value issue we try to address in the use of evidence, especially in healthcare practice. Yeah, thank you.
All right, thank you, Elizabeth, for those initial thoughts. I will be coming to you next, Michala, but just to invite all panelists, when you take your turn, you may want to share, put your videos on, so our audience can get to see these beautiful faces they are interacting with. And to the audience, you have opportunity to ask questions. The chat box is there. There will be a time dedicated along the line for interaction with your questions or issues you may want to bring out. So whilst listening to these discussions, you may want to ask some follow-up questions. You are allowed to do that. And also there may be some pressing issues for you may want to follow up on related to the subject matter of structural and value issues within our ecosystems. So kindly do that using the chat box. Let me continue with you, Michala, as you share your initial thoughts with us.
Thank you very much, Kirchuffs and Charity, for the invitation. It's a great pleasure to be here today, part of this panel. So, as you mentioned in my introduction, I work in evaluation, so I will be relating what I will be saying to the capacity development that the World Food Program has been doing in the national evaluation capacities. As you probably know, the World Food Program is an UN agency, and as a broader picture, I would like to mention that there are 2 United Nations Assembly resolutions that give a mandate to the United Nations organizations, program, and agencies to strengthen the capacities of the national evaluation system. So we've been working within this framework over the past 10 years when the first resolution was approved. And the World Food Program has been involved in different activities, from trainings, but also in many joint evaluations with national governmental partners. But what I would like to share with you, especially today, it's the work we have done on the National Evaluation Capacities Index, which we call the INSEP. So the INSEP is an initiative that has started in Latin America and the Caribbean. But I'm here today because we are thinking whether a similar initiative would have take up also on the African continent, and we started already conversations with few actors. We are in the very beginnings in Africa, but I would like to share what we did in Latin America and also hear your feedback and from the participants what you think would be interesting in your context. And I personally did work in Sub-Saharan Africa for over 10 years and have a very strong link to the continent. So what is the INSA? The INSA, it's an index, and it came about in 2017 when different actors in Latin America and the Caribbean were thinking how evaluation could be better positioned in the agenda of different actors as an important tool to contribute to evidence-based decision-making on social public programs. And the idea came about, well, if there are different indexes that measure different things, such as the Human Development Index that manage to position these topics higher on the agenda of the governments and other actors, why should not there be something similar related to evaluation? So this idea came about at a conference of the RELAC, which is a network of evaluation associations in Latin America and the Caribbean. And the working group composed of different actors was established. There were governments, there was academia, there were the voluntary organizations for professionalization of evaluation, and they started discussing how this index could be created. Yesterday, when I was reading the manifesto, I thought that actually what was done here on the index, it's very well aligned with the manifesto, because it was an initiative that was locally created. It was not imposed by an organization, but really there were 3 years of group work, some of them remote, some of them in person, to understand what national evaluation systems look like in Latin America and the Caribbean. So there was a lot of modeling, and also understand what is the aspiration, how these systems should look like. The second element where I think this was very linked to the manifesto is the National Evaluation Capacities Index not only allows to look at the system at one point in time, but also it's a tool that allows to look at the progress that the systems are doing over time. So how the other capacity development initiatives contribute to growing these systems. And we have realized over the time that it's not only the tool that we have that provides a picture of the national evaluation system, an entry point for different capacity development initiatives, because it helps to identify where the systems are strong and where they need more strengthening, but also that it's a platform for peer-to-peer exchange and for learning. So very specifically, what the INSA does. When it was developed in 2020, it was a tool that for collecting data on national evaluation systems, and for each country there is a set of questions that are answered by different actors within the national system. So as I mentioned, this could be government, academia, professional associations, but also international organizations. And from this assessment, there is a result of what we call a measurement in different dimensions. The INSA looks at 5 dimensions of national evaluation systems, which are the institutional structure, the evaluation offer, the evaluation quality, the evaluation use, and the multi-stakeholder spaces. After the INSA is measured, there is a discussion between all these actors that participate on what are the results and what further actions are needed to strengthen the different dimensions of this system. And then there is another measurement in a 2 years' time to understand what was the project, what was the progress. And if you would like to see more on the INSEE, there is a website where we currently have data from 10 countries in Latin America and the Caribbean. And I think I will stop here, put the website in the chat, and look forward for further discussion.
All right, thank you very much for those, Michala. And I think the audience would love to have a look at the website and follow up on those after. I will come to you, Faraja, for your initial thoughts on the subject matter of structural and value issues and how you are working it out in Tanzania.
Thank you, Kirchuffs. Thank you, everyone, panelists, and our dear participants. It's a great honor to be here and share on our experience from Shule Direct. As I was introduced, I work at Shule Direct, and we work in digital education. We have digitized national curriculums for primary and secondary schools here in Tanzania. So we have websites, we have mobile applications, SMS platforms, and learning management systems for schools. In the course of our work, we engage in content development, technical development, but we also engage in training and capacity building, particularly for teachers in school settings. So we also work towards continuous professional development for teachers. And I'm glad that the other panelists spoke about a number of different areas, but I would really like to focus on, from our experience, on digital analytics and how that translates into evidence and how the evidence translates into improved structural but also value systems for policies and strategies in education here in Tanzania. And I would specifically want to highlight our experience from our web analytics and mobile analytics, how we have been using internally, how we've been using the feedback to improve on our programmatic interventions, but also to improve on the best platform to promote or to innovate next. But in the last few years, we have seen a lot of insights from our users engaging online in terms of behaviors. And our key users have been teachers, students, parents, but also schools. So by schools, I mean the administrators. And what you find is that, for example, with our teachers' resource centers, our digital teachers' resource centers, teachers would come in to access the missing content that is not available in the schools, or perhaps not very clear in the curriculum resources provided by the government. So when you're looking at our individual users, when you're looking at the data, or when you're looking at statistics provided nationally, in our case, it could be basic education statistics, and how you find the trends and behaviors online, you actually see a match. So for example, if a teacher is in a location where the updated curriculum or the updated teaching resources have not been accessible, you actually find them accessing the same missing content on our digital platforms. It's the same case with students, where you find that a student who has an absent teacher, for example, in mathematics, you'd find that in that particular region or in that particular school, most of our students will try to get online and access resources for mathematics. So at individual level, in terms of the value and in terms of what we usually find to be digital analytics vis-a-vis our physical learning experiences, what we learn is that the digital world and the physical world really speak to each other, and any aspect that is missing in the physical world, a student or a teacher or a parent will try to supplement it with the digital world in terms of accessing the resources. But what we've also been learning very critically is when we're engaging with the government, and Shule Direct in Tanzania has engaged with the government on the school information system. So our platform is available via the National School Information System as the official e-learning content provider. And the experience has been very insightful in the sense that all the challenges that we see among teachers as a profession in terms of how to create content, how to create teachers' guides, how to create lesson plans, how to structure the academic calendar for students, how to mobilize students in terms of applying facilitation skills, how to organize coursework. What you find to be challenges are the same resources that they will go for on the school information system and particularly on our platform. And we've been using the feedback, the analytics from the school information system in collaboration with the government to actually inform the Tanzania Teachers Continuous Professional Development Strategy. So it's very important that sometimes when we're doing research, especially qualitative research, you may find that the assumption is quantitative research won't speak to qualitative research. But when we're developing the strategy, we've really been able to narrow down that quantitative research can speak to qualitative research. The data speaks for the gaps that we see. And when we're testing different capacity development for teachers, when we're testing new skills, when we're testing new resources online, it really gives us better insight into improving our resources and improving our strategy to support teachers better. So when we're looking holistically at, again, the initiatives in the digital space, digital platforms, and to be using them, and I would really like to advocate the use of data to inform evidence, especially with policymakers, because what we really find is that the data, when it's from a digital analytical platform, the data actually speaks for itself. Numbers don't lie. And what we find to be interventions later on based on these numbers, they actually do meet the gaps that we've identified based on the data. And I think significantly what we also find overall is the whole aspect of being able to look at the ecosystem in terms of how do we create a digital ecosystem that speak to each other and share this evidence within. So when you're looking at a digital platform that has multiple users, whether it's parents, teachers, students, and schools as a unity, to be able to actually connect the different data pieces and enable us to analyze and come up with different strategies, mainly because we're not looking at one entity, but we're looking at their relationship with each other, has really enabled us to come up with solutions not only for ourselves, but to also inform the national strategies and policies overall. In Tanzania, we're working on also on the national EdTech strategy, and significantly a big part of it has been looking at how best do we use evidence, but also how best do we create sustainable evidence generation mechanisms that are not necessarily looking at one component of the education system, but looking at all the different users, but also looking at all the different learning experiences that we're getting on the digital platforms. And so to just conclude.
So, Faraja, okay, yeah, just conclude there.
Yes, to just conclude, our web platforms and our mobile platforms have been a cornerstone of understanding online digital learning behaviors and patterns, and to be able to see the interconnection between the different users. Thank you.
All right, thank you for those, and I will quickly move to raise the very focal issues for today, which centers around structural and value issues. So I will go around again, but quickly. I will start from you, Michala, and then I will take Albert and Faraja, and then Elizabeth will come. So yeah, let's see how your organizations or interventions aim for longer term impacts and sustained use of evidence of capacities developed, the capacities that you seek to develop. How does your organization or interventions aim, or how do you structure your interventions to target or to attain longer term impacts? Particularly those that relate to sustained use of the capacities that you have developed. And how do you measure or demonstrate these as well? If you can quickly make 3 to 4 minute submissions each on these, this will be very much appreciated. So Michala, you want to start with us on that?
Thank you, Kirchuffs, for the question. So for us, what we do, and specifically what we do in the National Evaluation Capacities Index, the longer-term impact is about participation and the local ownership, because we believe that if the index is owned by the governments, by the national actors, and there have been a number of countries participating. There's been Mexico, Costa Rica, Colombia, Ecuador, Peru, Argentina, Uruguay, Paraguay, and the Dominican Republic that's been involved in the initiative over the past 3 years. If they really own this as something that helps to solve their problem, then the index and also all the work that's related to capacity development and related to the index will sustain for a longer time. That's why I said that this was a collaborative effort to develop the index and how it should be looking at the national evaluation systems in Latin America. And if we do something similar in Sub-Saharan Africa, we don't think just take the tool that we have in Latin America. We think rather to replicate the process and really have a discussion with the different actors in the national monitoring and evaluation systems about how their systems look like, how they think they should look like, how we should assess them, and look at the progress. So the Insights, it's a measurement tool, so that's how we assess the progress. And I would like to share maybe the experience of one country during the GLOCA, the evaluation week that took place a month ago. We had Patricia Moreno, who is from the government of Colombia, who was sharing with us how the government of Colombia actually decided to embed this solution into their government strategy. And they have it as a part of their strategy that they will use the index regularly to assess the progress they are making in their national evaluation system. And there are several other governments that took the decision. So in a nutshell, for us, the sustainability and longer-term impact, it's about really peer-to-peer participative processes and building this local ownership of the solution. And I will stop here.
All right, I appreciate that. So yes, Albert, let's pick your thoughts as well.
Thank you very much. So we have the longer term sustainability is critical for us. Because with a lot of our work, because it's technical in nature, the risk is there that when we leave, then the initiatives that we implemented and the tools that we developed, they fall flat. So there are 3 things that we do. The first one is that we work a lot with the decision makers themselves. So at a strategic level, with the management at an organization. And the advantage that we have in Rwanda is that the government of Rwanda and the policymakers have a very strong performance-driven culture. So there are clear KPIs that each government entity has to meet. And what we do is we then align our initiatives with those entities, with those KPIs. So there's a clear value link for them to the work that we do. And then we, on a technical side, when we implement solutions at these entities, we work very closely with the staff at our partner entity. So to use an example, the Ministry of Agriculture, they collect prices of agricultural commodities across the country. Now, as all of us experienced in the past 12 months or so, there's been a massive increase in inflation across the world, and particularly in the prices of food products. And by working with the staff at the Ministry of Agriculture, we developed a dashboard through which the government can then track these food prices, which links directly to a number of KPIs of the government. And then when we finish the implementation of that tool, then the local staff at the Ministry of Agriculture were sufficiently capacitated to continuously maintain that tool. And then I think lastly, we established a community of practice within in Rwanda on data science. So we bring a group of data scientists together working at all different kinds of entities. And then we discuss these initiatives that we've done, how we develop the capacity of the members at those institutions, and also sort of showing a vision about how to how they can get there themselves at the entities. Let me stop there. Thank you very much.
All right, thanks, Albert, for those. Yes, let me come to you, Faraja. How do you seek longer-term impacts within your capacities that you're developing? Yeah.
Thank you. Thank you. Yes, as I mentioned earlier, that Shule Direct, we have integrated our web platform with the school information system, and it was part of the same intention to actually look at how best it can be sustainable, but how best the value that we are creating in evidence to be used, and data, of course, to be used by the government public school information system. So the integration has been very successful, and we're seeing a lot of traction in terms of the use of the data to inform practices within schools, but also within the regional education offices. But on the other hand, one of the plans that now we have in the pipeline is to now mobilize education network, but also mobilize teachers union and teachers service commission in terms of capacity building for teachers, because we are looking at teachers not only as the centric focus of any school, but also the centric focus of any evidence and data generation personnel within the school system. So instead of just looking at a teacher as an educator, but we're also looking at them as key evidence and data generators. And so we are looking at having a comprehensive training module that can assist teachers in using not just Shule Direct as an e-learning content or platform, but overall the school information system, but also be able to analyze, generate data, but also analyze the data to inform their practices within the schools, which in turn will inform the practices and strategies at the district, regional, and national levels. Thank you.
Welcome, Faraja, and we will have your thoughts, Elizabeth.
Yeah, thank you. So in terms of making our work sustainable and ensure that the appreciation of evidence practice is sustainable, our partnership, mainly we work in partnership with international academic institutions. So this has ensured that we are able to offer capacity development for healthcare workers, and we have a number that we train each year. And through this partnership, it means there's the problem, or rather the challenge of funding to access these skills is sorted out. Then we also ensure there is evidence generation, and this in terms of we support the people we've trained to do systematic reviews, implementation reports within their areas of work in the healthcare space. Even us as an organization, we regularly do implementation reports and support evidence regeneration for different areas of health. In terms of partnership, also we seek partnerships with academic institutions, especially for the healthcare trainings. So we ensure that we're able to train more students, postgraduate students, to use evidence in their work or to have the skills to further their work. We also, in partnership, provide certifications. So these are certifications that give them the capacity to appreciate evidence and also source for funding to generate evidence. In terms of working with the government, within the healthcare space, we've worked with policymakers in data and health management information systems, and we've been trying to address interoperability between private health practitioners and the government system. so that eventually we have a way that the government is able to have more data, and the systems that are there within the healthcare space are interoperable and can speak to each other. So that is, we also produced a paper on interoperability of health systems and the readiness of Kenya. And in terms of value issues, how we address value issues is that we co-create programs with the government practitioners that we work with. We also have forums where we actually train, or rather have a discussion on evidence literacy. So evidence literacy is having the government practitioners and the healthcare workers to have the ability to integrate evidence into their general practice. This is basically not looking at evidence out there as jargons, being able to summarize what is out there and easily integrate it into their general practice. So we monitor that by the publications that are there, evidence pieces that are there, briefs that are produced by our community of practice. And also in the healthcare practice, we have private organizations that we've worked with, and they've been able to integrate evidence practice within their employees or within their organization. So I think I'll stop there for now. Thank you.
All right, thanks for that as well, Elizabeth. And so I will be moving now into the questions. But so the audience, if you have questions, you may put them through here. But when there are limited questions coming through, we can continue the conversations. But for now, I see a question from Ronald, and I think it's aimed at Albert. So it's asking, how are you and your program, he means, spending quality time, as you suggest, to ensure sustainable capacity enhancement at individual level? Maybe you take this and then I can come through with the other two questions that follow. Albert?
Okay, thank you. And let me switch on my camera. Thank you, Ronald, for the question. So in terms of spending quality time, I think what we typically do is we start off by identifying the staff members at an entity that we would like to work with. So say we want to implement a tool, and the agency that we're working with, they have 5 data scientists. Then we identify a subset of them, and then we include them in our training courses, which we run once a quarter. And then once they've graduated from that, then that's the team that I manage. We will either from our local staff at Rwanda or from South Africa, where the Cenfri headquarters is based, we will then go to Rwanda. And then we spend a month, 2 months working at that entity to develop and implement the solution. And in that process, they become part of the project team. So sometimes it's a bit of a challenge because the staff members at the partner institutions, they have their own responsibilities, and their manager may not fully understand the resources or the level of effort that's required on our project. So that is a negotiation that I don't have to do. But these staff members of our partner institutions are then included in the project, and they are assigned responsibilities with our oversight. And then it's finding out their level of competency and how and their ability to take that work forward. But that is then our challenge, is to make sure that by the time that we leave, that these staff members can do that work. Thank you.
Yeah, so I guess the issue of spending quality time is addressed, how you're achieving that. So I'll join the next 2 questions. Is asking how you're balancing capacity needs assessment with the actual action planning and implementation of your beneficiary organizations, or the actors, in light of their expectations, considering data analytics can entail both skills and information systems development. And then the last part of the question is, what are some of the strategies that you're using to stimulate demand for evidence use among high-level policymakers? So if you can make it quick with these two, yeah.
Okay, I'll be quick. So on the that first question about balancing the capacity needs assessment with the actual implementation, yeah, well, it's a balance. So I think the partner entities, they have an incentive to have longer term sustainability of our work. So this is then something that we specifically discuss ahead of time when we start the project, and we work around their deadlines. So it also depends then how much resources we from our side put into the project and how much they make available. So if there are strict deadlines, then we do put in more resources from our side, but under no circumstances do we not work with people on their side, because if there's no long-term sustainability, then we don't really see much value in that work. And on the strategies to stimulate demand, I think there are two things. The one is, like I mentioned earlier, is to be very aware of their key performance indicators and ensuring that the evidence that we generated through our data analytics, that speaks directly to their KPIs. And sometimes with data, it brings things to light that people don't always want to know. So that's sometimes a bit of a challenge. But then the other thing that we find is that data is a little bit, it's a little bit like a drug. The more you see it, the more you have, the more you want of it. So generally, we find that we generate quite good momentum once you can start showing initial value in the work that you do on data. Thanks.
Great thoughts on those. Quickly, Patrick asks questions that goes to our panelists, so I will skip Albert in this. Let me take your thoughts, starting from Faraja, and then I'll come to Elizabeth, and then, okay, I'll come to Michala, and then I end with Elizabeth. So Faraja, you want to share, take note of this question from Patrick. Is asking, I would like to know if you have in place some strategies to enable scaling of your innovations and concepts to other organizations, particularly within the Africa Evidence Network, considering that we are having these discussions in here and your work in one way or the other is on the continent. And so do you have plans on these projects to scale up to other countries? Faraja.
Yes, thank you. Thank you for the question, Patrick. Yes, we do. I would just like to highlight that generally they are available analytics online, but I think the difference with our particular analytics is the fact that we've actually customized them and we built them over time in consultation with teachers, in consultation with learners, in consultation with teacher trainers, in consultation with policymakers, and I'm really keen to see how our model of analytics can be used in other contexts, and I believe they can work with any curriculum, they can work with any web platform. All our analytics are mapped within our educational content repository, and we have developed APIs that allows integration with other digital platforms, so it's a matter of plug and play. And I'm really keen to see how best these back-end systems can be used with other organizations, with other digital platforms. And my apologies in the sense that I think they work best with digital platforms or people that are intending to have indexes or to have communities of practice that want to leverage technology on digital spaces. Yes, so we are keen on that, and we have comprehensively developed the system over time. Thank you.
Welcome for those thoughts. Yes, Michala, you want to take your turn on that?
Thank you, Kirchuffs. So I think very, very briefly, I already explained that the INSE is a multi-stakeholder initiative. So how it was created in Latin America and the Caribbean, basically we invited everyone who wanted to participate with an important role, of course, for the actors coming from the national governments and the directorates for monitoring and evaluation. So when we are now starting to think how to take this initiative to sub-Saharan Africa, the principle would be the same. The initial stage of conception is very much open to any interested actor to join the discussion and the modeling how the INSE or how the national evaluation systems in Africa look like from the countries, from any country that may be interested to be part of the initiative without any commitment, because even in Latin America and Caribbean, we had countries that were there when we were doing the modeling, and then they have never measured the INSE so far. So it's very much open as a platform for stakeholders to join, contribute, listen in. Then when we enter the actual phase of measuring and using INSE, it's clear that it focuses on national evaluation systems. So it's the governments who hold the ownership about their national measurement and about their national data. Thank you.
Thank you for that. And quickly, let's take your thoughts, Elizabeth.
Yeah, I'll put my video on so you can put a face. So the strategies we've put in place is that, like I'd mentioned, we seek out for partnerships. We work in partnerships with the international, and now we are seeking out partnerships with the other countries within the region. In part, we've worked with an academic institution in Rwanda. That was sometime last year, and we built the capacity of a cohort there at the university. Right now, in the next coming few months, we've sourced for funding to work on implementation, evidence implementation project across 3 countries in Africa. So those are the strategies that we put in place, and we are actively seeking partnerships within the region and also within the country. Of course, actively also, we work with government here to ensure that the skills are within the government healthcare systems. And yeah, so those are the strategies: actively seeking partnerships with government and private organizations and academic institutions to ensure that we have a community that appreciates evidence-based practice. Thank you.
All right, so with those responses, I want to believe the different initiatives are seeking to expand their reach beyond the current ecosystems in which they operate. I will go around with this particular question again, beginning with Michala. What mechanisms are we using, or are your programs using, to mainstream cross-cutting development themes such as equity and social inclusion, transparency, accountability? How are we working these out in our initiatives? So Michala, you can start with us. I'll come to you, Albert, and then Elizabeth, and then Faraja.
Thank you, Kirchuffs. So as I mentioned, the INSE looks on the national evaluation systems. And one of the dimensions that we look at is the quality of evaluations that are being produced within these systems. And for evaluations to be of good quality, it's considered that they also need to look at gender equality, women empowerment, but also at human rights. So basically, what we do through the INSE is to understand to what extent the evaluations and the way how they are being produced by the different national systems are considering gender equality, women empowerment, and the human rights. And then we have usually during the workshop, when we discuss the results, we have a special working group that looks at these results. And there's a tool that was developed with a partner organization which is called a gender scanner, which can even help to look deeper into the gender equality dimension. So that's something very specific. Then again, the specific development in these areas comes after the INSE measurement and based on the needs that are identified by the different stakeholders. Over.
Great. Great. Useful to hear that from the production side. Yes, Albert.
Thank you. So on equity, the the candidates that we receive for our training programs are sent by our partner institutions. So we do monitor equity to make sure, particularly on the gender side, that we have good representation from both genders in our training programs. And then what's also specifically important for us on equity is that we have good representation from the private sector as well as the public sector institutions. That you don't get a situation where the one benefits disproportionately more than the other from our work, because ultimately we do want to affect both sectors. And then the other one that I want to highlight is just accountability. So we have a very strong culture of accountability in our capacity building initiatives. Particularly on the technical side, the candidates have to first complete online courses before they're allowed to enter our training course, and then there are certain activities that they have to complete during the training week in order for them to pass the training and receive certification. Thank you.
All right, that's awesome to hear out. Yes, I'll take your thoughts. Is Faraja with us?
My apologies, we lost power and the generator's coming back on, so I disconnected for few seconds. I don't know where we are. If you can just update me.
All right, so we're looking at how our different initiatives are integrating cross-cutting issues such as those on equity and social inclusion, transparency, accountability, and things like that. How are we mainstreaming those into our initiatives?
Yes, thank you. And I think just to emphasize on the potential and the prospects of any digital platform or technology is in the essence that digital platforms are responsive and they are platforms. By saying platforms, I mean that they can actually integrate and allow different aspects of programmatic interventions, whether it's around equity, inclusion, whether it's around gender lens or human rights-based approaches to actually be factored in the design, but also in the deployment of the analytics, of the evidence, of the data. And I think in our case, for example, we are working on an inclusive education project, which is in 3 countries, Malawi, Tanzania, and Kenya. And in the process, we developed a policy monitoring tool, which is a digital tool, which we are using to look at the implementation of inclusive education policies. So we're looking at the practices of inclusive education policies and having a comparative analysis in the 3 countries. So we have mapped inclusive centers. We are also mapping interventions within those inclusive centers, and then comparing them between the 3 countries, Tanzania, Kenya, and Uganda. So we work with 2 organizations in Malawi and 1 organization in Kenya, and the tool is available online. It's called Pamotsi for Inclusive Education. And so the good thing with platforms, they're responsive, and they can also be custom made and tailor made to suit changing needs of the education system and changing needs around evidence generation. Thanks.
All right, thank you very much. So last person, Elizabeth, you want to share your thoughts on this quickly?
Yeah, so how we are doing that is through data collection and monitoring. And in terms of data collection and monitoring, is just to make sure we are collecting, or rather we have all the required data in terms of gender. And since we're in the healthcare space, then we also have, we ensure that we have data that is disaggregated by gender, social status, disability, upcoming diseases like the non-communicable diseases. So when we have these kind of cross-cutting themes in the health sector and they are collected well and monitored, then we have evidence for that can inform healthcare practice. Then also we have we make sure we have stakeholder engagement and participation. And when we say stakeholder engagement and participation in the project's implementation, we make sure that we try as much as possible to involve all the stakeholders, and using different methodologies, make sure that the evidence generated is appreciated and there is ownership of that evidence. Then we also we make sure that we build the capacities and awareness about data and how to use it, and how to include all the different cross-cutting themes. So in terms of evidence generation and research, we ensure that things like gender and our space, disability, NCDs, and other themes, social status, are also all inclusive, because now they inform evidence practice. Then we actively participate in evidence translation and communication, as I mentioned earlier, to have practitioners and the general stakeholders in the health sector be able to understand and appreciate evidence and how to use it in their policy making. Also, we try and do policy appraisal and evaluation where possible. So, for example, in terms of having robust data available, we looked at the policy in terms of the data frameworks, so the frameworks that are there for health technology solutions, for them to be interoperable. So these are some of the things that we are doing to ensure we address all the cross-cutting themes that are there in evidence, practice, and appreciation. Thank you.
All right. Thank you, Elizabeth, and thank you, Albert. Thank you, Michala. Thank you, Faraja, for your thoughts, very deep thoughts on your initiatives, looking at how we're differently seeking to address structural and value issues within our ecosystems across Africa and then beyond, and especially in this context within the Caribbean, Latin American, Caribbean nations. And at this point, I think we're bringing our discussion to an end. But I want to highlight how useful the different perspectives have been, looking at working through staffs in government agencies to support capacity development, using communities of healthcare workers and other, mechanisms, design mechanisms to make sure that our interventions are reaching beyond the immediate needs for longer term targets. And interestingly, we're looking at the different initiatives seem to be evaluating these, and these all together show that we are taking particular interest in the long-term impacts of our works, and not to forget the critical thing of the digital side, the web and mobile analytics that some initiatives are also using, deploying technology to help attain these realities or reduce the structural constraints that we work in. At this point, I will end the discussion here, but Sizizwe, you will take the opportunity and tell us what happens next.
Thank you very much, Kirchuffs, and thank you very much to our panelists as well. Thank you so much for the insightful conversation that you had with us today on the topic. Also, I want to thank all the participants that have joined us and followed this webinar series. I think in closing, just to say that the recording for this webinar and the blog will be published to ensure that we continue these conversations. You might have questions that you want to still ask or want to add your inputs in this conversation. The conversation will continue on LinkedIn. Please join us there as well. So thank you so much, really, for joining this session. And I hope you've learned something new that really will be helpful to the work that you're doing continuously. So thank you so much from the Africa Evidence Network. We're really grateful for you joining this session today. Thank you, everyone.
Thank you.
Thank you.